All right, hello everyone, and welcome to the Oregon Eligibility One Learning Series. Today, March 23rd, 2022, we're going to be talking about a recent change that extended eligibility for Oregon Health Plan benefits after a pregnancy ends. That is quite a mouthful, but we'll talk it out. And this is not going to take the full hour, so there's plenty of time for a Q&A. Please, for the folks who are on the line right now, use our question box, and for folks who are listening to this recording at a later date, know that you can always reach out to your regional outreach coordinator or anyone on the Community Partner Outreach Program team to get answers to any questions you may have. As always, we do keep our group site materials updated with these webinars, so you can get all past information on our group site website, this link that is listed here on this front slide. I'll be your trainer today. My name is Jessica Diaz, and I am the Provider Outreach and Enrollment Strategist for CPOP. The first thing I get to share with you all today is that we have renamed our webinar. So this used to be called the IE webinar, or Integrated Eligibility Webinar, and we are switching over to Oregon Eligibility Learning Series. Oregon Eligibility, as you may know, is the full name of the ONE system. ONE is an acronym that takes the end of Oregon and the beginning of eligibility and sticks it together. We want to commit to continuing to bring you the content that is, things that are new, things that are changing, or deep dives into things around eligibility systems, worker processes, how to make the most of our partnership across ODHS and OHA and across our network. So we're trying to align better with what we are here to do. And IE has started to be a term that is not really in use. It was tied to a project to convert the ONE system into this new upgraded version we have today. And so we're rolling with the name changes across the agencies, and we want to make sure that we continue to be up to date, not only in our content, but also in our name. So that's my quick note to bring you in advance of the meat of our presentation today. But if you were confused because you started to see different names, we wanted to lay that out, and you'll continue to see Oregon Eligibility Learning Series moving forward. Now, we don't have all of these folks on the line right now, but a lot of very passionate, intelligent people helped us bring this content to you today. And so if we don't have everyone here to answer all the questions right away, rest assured we will bring them back to the subject matter experts. We have, I am part of the Community Partner Outreach Program, so you have us here. The eligibility and processing staff, I believe, are on call. We have our policy folks who are very busy right now, but have committed to answering questions, maybe during this presentation, maybe as a follow-up, and continue to have, let's see, I guess David and Sean. David, do you mind introducing yourself first?
Not at all. Hello and good morning. This is David Ballantyne. I work for OHA and Health Systems Division. I primarily am assigned to the CCO operations team, but really I help and assist anywhere where we deal with customer service outcomes related to the Oregon Health Plan and Oregon Health Plan members.
Awesome, thank you. And Sean?
Morning, everybody. My name is Sean Snyder. I'm Regional Outreach Coordinator with the CPOP team with Jessica. And I serve the metro region, so I'm mostly spending a lot of my time in Multnomah, but also help provide backup support to Clackamas County as well. Thanks for having me.
Thank you so much. And now that we've done some of those first items, let's dig into what we're here to talk about today. We are talking about a change that has extended benefits, supplemental benefits, after a pregnancy ends for 12 months. So we're going to go over what are these protected medical benefits, what is new for pregnant individuals, a little bit of playing with the timeline of what has changed, what to expect, we really want to talk about not only what does it mean to have protected medical benefits, but what are those supplemental benefits, and to make sure that we offer you some resources and also answer any questions that we're able to. So first off, what does it mean to have protected medical benefits? All OHP members must report changes within 10 days, and outside of the public health emergency period, most members lose those benefits if those changes bring them outside of program eligibility. So if they go over income and report that, if maybe their household changes, the household is smaller, and so the income that they had now it has different factors that lead them to be outside of those eligibility factors. Ooh, said factor a bunch. So there are times when people report changes that cause them to lose benefits. And there are also some specific situations where we can protect coverage even with those eligibility changes. This goes by a couple different names and it's tied to a couple different sets of rules. Today, we're going to talk mostly about protected coverage for pregnant individuals. There are other populations who have protections that might be called, you might hear the term assumed eligible newborn or continuous coverage for children. So there are other populations who have various protections in place. Today, we're talking pregnant individuals, and the term that is most often used there is protected coverage, protected eligibility. I do want to note that this protected coverage does not apply if someone passes away, if they become incarcerated, if they move out of the state, or if they voluntarily tell us they want their benefits to end. And those exceptions might sound pretty familiar to those of us who have been working during the public health emergency because it aligns really well with the same factors that might cause someone to lose eligibility with the protections in place due to the COVID-19 emergency. So that's a very quick rundown of what it means to have protected medical benefits. Let's talk a little more about the context of pregnancy and OHP benefits. So what has been happening for quite a while is that if someone is on OHP and they report a pregnancy, they get protected eligibility during the pregnancy and then 2 months after a pregnancy ends. Starting April 1st of this year, OHP pregnancy level OHP plus benefits will continue not for only 2 months, but for a whole 12 months following the end of a pregnancy. So moving forward, and also this is being applied retroactively to cases that are active right now. And that's what we're going to dig the most into today, what this looks like and what it might mean for your clients. I do want to say right off the bat that this change at this time applies to people who are on OHP plus level of benefits and not to people who are on COWAM plus level of benefits. So everything we're talking about, and I'm going to repeat that again because I think it's important. I have 2 different slides that talk about that. OHP plus pregnancy level benefits are continuing. Those supplemental benefits are continuing for 12 months. COWAM plus do not have that 12-month additional period. And we'll talk more about that. So what exactly is happening and when is it happening? Or when did it happen? Since now it's been a couple weeks since we did our data fix. In early March 2022, pregnancy level benefits were restored for individuals for the remainder of their 12-month postpartum period if they, as of early March, are currently receiving OHP plus level of benefits, were receiving pregnancy benefits during their pregnancy, and had a pregnancy end date on or after April 1st of last year, 2021. So updated eligibility notices went out to a specific population. This is the folks who were on pregnancy benefits. Those benefits already changed to adult OHP plus, so a non-pregnancy level plus level of benefits. And then need to be restored. So there are two things we're talking about today. There's the new rules moving forward, which is 12 months after a pregnancy ends. And I do want to say the words postpartum show up here in this presentation a few times, but I know postpartum is usually associated with a live birth. I do want to clarify that this is not to a live birth. Any reason a pregnancy could end, this still applies. So end of pregnancy, no matter the reason that pregnancy has ended. So the change moving forward is one thing that we have talked about. And then this additional context I'm giving you right now is what happened to retroactively restore the benefits so that they align with the new policy. I probably said that in the most complicated way possible, so don't worry, we're going to circle through it and give examples of timeline to make it clear. And I said this once before, but I'm going to say it again, and we have a whole slide devoted to it, which is, who does this not impact? And I have an example here, and I'll say another one out loud, which is this does not impact, this change in policy does not impact people who are receiving Calum Plus benefits. Calum Plus is that citizenship waived medical for pregnant individuals. Those protections stay during the pregnancy and 60 days after the pregnancy ends. So it is protected for the duration of a pregnancy and up to 2 months afterwards, not the 12 months, just the 2 months. And that is how the rules are written currently. And so that is how we will continue to be doing business for the time being. And here is an example of what that timeline might look like. Here's a hypothetical individual and what they would experience if they had a pregnancy that ended, let's say, on July 3rd, 2021. Their OHP plus pregnancy level benefits continued through all of the 2 months after the pregnancy ended. So that's all of August, all of September. At the end of September, it switched to adult OHP plus instead of pregnancy level OHP plus. With this fix and this new policy, we did a mass update in early March. It was actually March 2nd, 2022. With our system update, we restored pregnancy level benefits all the way back to the month that the pregnancy ended. And I'm going to talk in a second about what it means to have pregnancy level benefits versus adult OHP plus. But the way the systems now show, now that it's after March 2nd, is that pregnancy level benefits are throughout the duration of the pregnancy, and then they continued, and they will continue up until a year after the pregnancy ended. So ended in July of 2021. Those pregnancy level benefits are now slated to turn into OHP plus adult again at the end of July of this year, a whole calendar year. Now that this change has happened, providers can bill for any supplemental benefits that have been provided anytime in that period where people were on OHP plus adults and have retroactively been restored to pregnancy level benefits. And so it may be a little confusing for folks, but there are new opportunities here as well as far as taking advantage of those benefits. So you might be wondering, as a community partner, what am I going to be seeing? Maybe what will people be bringing to me, and how can I help them make the most of these additional? It's an additional 10 months because we already had 2, but in all 12 months after a pregnancy has ended. People who were pregnant and are eligible for this additional postpartum pregnancy benefit will have an opportunity to get those supplemental health care needs met for a whole year after being pregnant. And so, yes, some folks have received what are probably confusing notices of eligibility, which might make them think like, why is it saying I'm pregnant when I'm not, or was pregnant sometime in the past year? If they come to you with a notice and are confused, or call you up and say like, I got something from OHP, it doesn't make any sense, here's some advice that we have for you, which is it might be a great opportunity to let them know what those supplemental benefits are that they currently have, and maybe help them connect to providers to getting that care before that postpartum coverage closes. And I feel like it's important to talk about what those supplemental benefits are. So during a pregnancy, adults can have access to some benefits that usually aren't available to adults on OHP. That includes glasses, contact lenses, eye exams, a lot of some dental items that otherwise are not available, like dental crowns, replacement of full dentures, root canals, other tooth root procedures, some gum or oral surgery. So most of these are related to vision and dental care, supplemental vision and dental care. And so those are things that if people don't know they have access to this, they might not be using their benefits to the fullest. And that's a role that as a community partner, our network can really help reinforce that these are important things if you are able to access them, maybe at this time in your life and not at other times. We want to help people connect those dots, help them connect to providers, to vision and dental providers when possible. And so it is really exciting that we have been given the flexibility by the federal government to extend these supplemental benefits more than the 2 months postpartum. And that's why we have decided to spend our time today focusing solely on this, because we think it is an important update that has enough moving parts that it's a little confusing. We sent out a special community partner update on March 8th going over this. It is also available as a PDF on group site. And there is also, it's included in the CP update, but also you can access it separately. A memo went out to OHA providers talking about supplemental benefits as well. And in fact, I can quickly show you what that looks like before we get to the Q&A portion. I'm just gonna bring this out. And so, yeah, go ahead.
I was just going to mention really quick, just let folks know that I'm getting everybody's questions and I'm just organizing them for the Q&A afterwards. So thanks everybody for the really good questions.
Oh, fantastic, thank you. So very similar to the content that we gave today, but this was designed for OHP providers. Goes into the details of what is covered, who it affects, and what it looks like for people who lost supplemental benefits, as well as a little bit of context. As I mentioned, this is the flexibility we've been given as part of updated federal guidance, as part of the American Rescue Plan. And with that said, I know that people have questions, so let's get into them.
All
I
right.
don't know, Sean, if you want to read them out loud to me.
Yeah, I definitely can. Yeah, so I tried my best to organize them, I think, based on kind of relevance and how we want to go through them. So we'll see how it goes. And I don't know if folks need a little bit more clarity on this. I know you covered it a little bit on, why does the 12-month pregnancy not include Callum plus pregnant individuals? Do you feel like we need to provide clarity on that, on why it isn't extended to them?
I would say for me, and I'm not a policy expert. This falls into the category of this is how the rules are currently written.
Mhm.
And I know we are exploring possibilities, but we don't have anything currently in rule to help us with that COWM plus post-pregnancy coverage. It is something that I know is actively being explored, but at this time, it's not part of the fix that went in on March 2nd, and it's not part of the rules as they're currently written. I know that's not a very exciting answer, but it is something we're continuing to look into.
No worries. Let's see. All right, and this may have been clarified already, but I'll just go ahead and read it. It says, I was told that this was only going to be for those currently on OHP and not retro to those who already are off. Can you clarify?
Yes, good question. And I think, let me go back to the slide that breaks this down. So these bullets here. So this particular change applies to people who, as of March of this year, were actively on OHP plus level of benefits, had received pregnancy level benefits, and had that pregnancy end date on or after April 1st, 2021. So if someone has, for instance, voluntarily ended their coverage before March of 2022, then this does not apply to them. And so it's only people who are active on that OHP plus full level of benefits for whom this applies. I hope that makes sense.
Yeah, I think it does. Let's see here. Then we had a question of, so the term will go back to OHP plus pregnancy. Is that a kind of a correct way to describe the benefit level?
Yeah, I would say that people's pregnancy level, those supplemental benefits were restored for people who lost those benefits, and those supplemental benefits turned into OHP plus without the supplemental benefits.
Mhm.
And then moving forward, this protected period has been extended from 2 months all the way to 12 months. So those are a few different ways to talk and think about it. And I think I see a follow-up that's sort of in this as well. OHA letters did officially go out to some clients, the folks for whom their benefits change. If someone is actively in their postpartum period this month, they would not get a letter because nothing has changed. That letter that tells them that things have changed, it'll be delayed. Instead of coming at the 2-month mark, it's coming at the 12-month mark.
Perfect. And then let's see. So, I think this is really good for us to continue to think about in how our letters are written. So one person was mentioning that this is really great for clients, but is there a way for the notices to minimize emotional trauma for those who may have suffered miscarriages? Perhaps you were pregnant during this time frame. As such, you are now entitled to extended benefits during this time frame. I don't know how flexible we are
Yeah.
with doing that.
Yeah, I love that recommendation, and I will bring it. Unfortunately, our policy folks had to hop off, but I will bring it to them because I know they are working on notices.
Okay.
So thank you so much.
And then Patricia had a really good question on, will this extended benefit have any effect on someone who has employer or other health coverage?
That is a good question as well. I cannot speak I'm not an expert in employer health plans and what their specifications are. I know as an adult, you can have employer coverage and have OHP, and the two should not interfere with one another. Because this fix only applied to people who are actively on OHP, we don't expect it to cause problems with the marketplace, as long as people are aware that they do still have OHP.
Mm.
But if there are other situations that folks are concerned about, I would love for those to be sent our way so we can look more into them and make sure we're giving you good answers.
Okay, perfect. And then let's see here. So when this change occurs and OHP members are added to OHP Plus, will this be through managed care like a CCO? And I'm expecting that's going to be yes, because they technically haven't lost, their CCO coverage. They would just continue. It's just added benefits, correct?
Yes, yeah, we would expect people to persist on their CCOs. They've had OHP Plus level of coverage this whole time, so they should not have dropped off and back on. With that said, if you see anything that looks concerning, please let us know and we can look into it.
Okay, perfect. And then someone's asking, how will this appear in MMIS? Will it be listed as supplemental? And how do we, this is kind of my added on question, how do we reduce confusion for providers?
That is a great question, and I haven't seen an example of the MMIS screen for this. So instead of, I'm not going to try to make it up, I'm just going to make a note to go find that.
Okay, perfect. Let's see, apologies, some new ones have jumped in, so I'm just trying to follow up and catch up on them. Okay. And Jessica, let me know if you happen to see any others that you'd like to jump on before.
Oh yeah.
Let's see here. So this was a question that someone said maybe fit more for David, but I'm not sure. It says, David, this might be a question for you, but let's say a pregnant mother has a change of address, maybe from Polk to Yamhill County or vice versa. Would a pregnant mother be able to keep her established obstetrician? So I guess it would be more like if they had ended those benefits and maybe moved, would they be able, once they retain those benefits, to be able to continue their care with the provider they had had previously?
Sure. Thanks, Sean. This is David. So I think all the rules that apply to what we call it transition of care, if you haven't heard me speak about that, that are there to ensure that if a member moves from area to area, that the receiving managed care entity or CCO is obligated to maintain that care until they can either establish an equivalent care, equivalent style or care level themselves. And usually what happens is that they just maintain that through the life of the event, so to speak. So all those rules would still apply in any movement scenarios that might be out there.
And I know one specific carve-out population for having open card for continuity purposes is folks who are in their third trimester of a pregnancy at time of application. So this is vaguely related. If there are folks who are maybe having some other transitions and are new to OHP towards the end of a pregnancy, there are some protections written as well. That's a tangential update, but that may relate as well to some of these situations you may see.
And then I think some folks had some clarifying, either joined a little bit later, just need some clarification. So one person asked, just to clarify, only individuals who remained on OHP are able to get the 12-month extension or a 12-month retro benefits, correct?
That is correct.
Perfect.
This whole change only applies either moving forward or to the folks who, as of this month, are on OHP and had a pregnancy. I do see some questions that relate to CALM and the upcoming program Healthier Oregon, and I can speak very broadly to them. So this specific extension, as it is currently written into law and as it is currently operationalized, applies only to the folks who are on OHP Plus, so it doesn't apply to CalOM Plus. CalOM Plus is still going on the protected during a pregnancy and then the 2 months after a pregnancy ends timeline, and that has not changed. We do expect there will be some folks who, when Healthier Oregon goes live July 1, will transition from CalOM Plus level of benefits to having full OHP Plus through Healthier Oregon. And I can't speak to all the mechanisms for that right now, because I'm not yet an expert in exactly how that's going to go down. But I do know that we expect that this 12 months will likely apply to those people as well if they are on Healthier Oregon full OHP benefits. But we will have more details in the future about exactly how that's going to work and what it will look like for people. So I see there's a lot of interest in that, and I'm flagging that for our Healthier Oregon folks, and we'll have more answers for that soon.
Definitely. And then, yeah, someone had a really good question, or more something that we might want to clarify for our team as well. It had mentioned CALM is going away in July, anyways, and this new rule will apply to everyone in July, correct? So I just wanted to clarify too, CALM is not necessarily going away in July. The new Healthier Oregon program, and correct me if I'm wrong, Jessica, will be extended to folks that are aged 19 to 25 and folks that are aged 55 and older. Immigration statuses will not be a factor in their eligibility, but for everyone else, they would still fall into the CALM category, correct?
That is correct, yes. And I'd say when it comes to pregnant individuals, most CALM Plus members are in that age range of 26 to, well, probably around 40, in mid 40s. So we will likely still have quite a few people who are on CALM Plus on July 1.
Mm-hmm. Okay, let's see. Okay, so Renee actually had a really helpful notice for us. She's had a client called in after she had received her notice, and on MMIS she had BMH, and now it states BMP OHP supplemental. So just as that might be how it's appearing for folks, just for our reference.
Yeah. So for folks who are used to the MMIS acronyms, that probably means something to you, and the folks who are not, no worries. It means supplemental pregnancy coverage. So that's a really helpful clarification. Thank you, Renee.
Okay. And feel free, David or Jessica, if there's anything that I've missed. There's a couple I was saving for kind of a collected conversation. Marina's brought up some really good points about marketplace coverage and enrollments as well. She's mentioning people whose household is between 139% and 150% of FPL can voluntarily end their OHP benefits and qualify for a special enrollment period on the marketplace. So that may be helpful to some folks. I know there are a lot of individuals that were wanting to transition from OHP to marketplace coverage. Let's see here, and then let's see.
And then I do see some, oh, sorry.
Oh no, go for Jessica.
I see some questions about the Reproductive Health Equity Act programming and coverage, and we don't expect any of those things to change. So things that were available to CALM individuals or individuals even who are uninsured, those are continuing to be available, all on the same timelines and with the same rules as they were before. So if anyone is concerned about the Reproductive Health Equity Act and all of the things that are built into that, those are still active even with this additional OHP.
Perfect. And then I think someone asked for a really good clarifying question. I think this kind of just comes around full circle for a summation of the information for today. They said, so if someone reports a pregnancy next month, will they get OHP for the duration of the pregnancy and 2 months afterwards, or is this 12-month extension for all pregnancies going forward?
Absolutely. I'll add the caveat of it's for OHP plus, not for CALM plus again, just because I want to make sure I'm being super clear about this. From here on out, and in fact, retroactively from April 1st of last year onwards, the coverage will be 12 months, not 2 months. So if I report a pregnancy today, when my pregnancy ends, no matter why it ends or when it ends, I would get an additional 12 months after that end, as long as I am on OHP plus level of benefits and not on CALM plus. For CALM plus, it is still 2 months after.
Perfect. And I think that that's this is really exciting because just for folks to be able to retain those extra benefits for a year after is fantastic. And just for clarification too, I know just we mentioned this, and that's they get the 12 months benefits regardless of how the pregnancy ended, correct?
Yes.
Okay. All right.
I do see some concern about returned mail. I know for sure because of the public health emergency, we are not closing people right now due to returned mail. So no one who received this one-time special update notice should have any consequences from that. I could not speak to what's going to happen once the public health emergency ends because I don't know those rules yet. But for now, rest assured that those folks are protected as well.
And Jessica, this is just kind of a question that I'm thinking about, and there may not be an efficient or easy way to do this, but do we know if would be a way for our community partners to proactively reach out to community members to make sure that they know that they have extended benefits or added benefits? There wouldn't be a way for them to necessarily know that they have gotten this notice, right? Using their One Portal?
That's a great question. I believe that these notices populate in the portal. So you would see them on, let's see, if the fix went in on March 2nd, probably you would see that batch on March 3rd, which that should stand out in the message center, I think, perhaps. You'd have to click in and find those cases. I think that would be the best tool available to a community partner. Does that sound right, Sean?
Yeah, I think that sounds right. And that might be the only thing that I know is it might be helpful for maybe us, and maybe we can look into this, is to figure out like when it shows up in the portal, what does the subject line of the notice say? If there's anything that folks can kind of target or look for when trying to catch folks. That just may be a helpful way for you all to kind of proactively, in case someone does happen to have an address that's out of date, to maybe reach out and try and support folks. They may not be losing their benefits because their mail got bounced, but then they may not be aware as well. So that might be a helpful way that you guys can continue to work with community.
I'm just realizing actually, I'm going to run a couple things by our policy folks to make sure I have them right, but I believe this protected eligibility might also apply to returned mail in general because it is protected other than the reasons I named. And returned mail was not one of the reasons I named. So even outside of the public health emergency, I'm now deciding people who are in that after pregnancy period should continue to be protected unless they have let us know for some reason that that protection doesn't apply to them. And that means that they are saying, yes, I want to close my benefits anyway. I've permanently moved out of this state. If we hear a report that they've become incarcerated, or if we hear a report that they've passed away. So I am realizing the protection is even cooler than I originally sold it as, because it does include, it should include things like going over income. It should include things like changing households and also returned mail.
Yeah, the protected eligibility is really, really, really helpful because we even talked about this internally in our team. Is like if even in the same household, if their spouse had benefits and they went over income, the spouse might lose coverage, but then the mom wouldn't because of that protected eligibility, even if a change in income would have normally put them over until they're outside of that 12-month extension. And then we had a really good clarifying question as well, Jessica. Let's see here. Was saying if someone has another pregnancy while they're within their 12-month protected, would that then their protection for the pregnancy would continue until the end of that new pregnancy, and then they would get 12 months more of protected eligibility, correct?
Absolutely, yeah. And absolutely, if someone is in this protected period, community partners can still continue to update cases with new information. You can report a pregnancy, you can report address changes. All of those things you would do for any other case, you can still do for a case that is in that protected status. So it doesn't in any way cut out your ability to take action on a case and to help people throughout that period.
One question actually, Jessica, that I just had is if a community member comes to a community partner that maybe they haven't worked with them or seen them in a little while, or they're brand new working with them and they get connected to their case, would there be any way for a community partner to identify that they have these extended pregnancy benefits just based on their portal? Or would the only way for them to tell would be, say, access to MMIS or hunting for a notice that they may have received in the past?
I believe, oh goodness, community partners, you can let me know if I'm wrong about this, but last I heard, you only see notices that populate after you've become associated. So any notice that was previously on a case might not be available to you. So I think it really is that provider portal, MMIS, that's the only way to confirm if someone is on supplemental coverage. And that is a good thing for us to bring back to our folks to see about if there's a best way to get that information. I think one hint that that might be happening is if you see something that you think would cause someone to no longer be eligible, but they are keeping their eligibility, or if just a woman is keeping just a recently pregnant. Yeah, there's a lot going on there, and I want to give better advice than I have at my fingertips right now. But I think you could always ask the CP line or the Oregon.benefits email. They can check status and they could confirm something like that. If you have access to the provider portal to MMIS, that is another tool. And I don't believe anything would show up in the one system that would, I'm trying to think of it. I think it just would say full medical,
Okay.
but I'll double check that with our folks.
Okay. That just might be helpful for folks to know, and be one of those things too when you're working with folks, is when you're going through an application asking if they have had a pregnancy that ended in the last 12 months. That might at least give you an idea on a potential timeline on when they might have those protected benefits, just at least in the meantime until we have more for you guys. Let's see.
Yeah, and I guess one thing I do want to stress is that regardless of if they have the protected benefits or not, that doesn't change the reporting requirements in any way. So other than helping people connect to actually that care that is included in their benefits, you should still be doing the same actions around, if someone is reporting information that makes them over income, we need to get that information to the state. That's our role, things like that. That doesn't change. These are all excellent questions.
Yeah,
I do see one related to, this change was tied to a COVID-related bill. So is it tied to the emergency period? And the answer is no. I believe this is moving forward. I believe this is in rule now more generally and not tied to those flexibilities that are specific to the public health emergency. But I know that's a little bit confusing because it did come out of legislation that is tied to the public health emergency. So I want to run that by policy to make sure we're right there.
And it may be good for us to clarify too. It looks like, and I may be just be reading this incorrectly. It looks like some folks might be mentioning that they are only able to see the notices after they're connected, and some indicate that they are able to see all of them once they're connected. So I may be just be reading that wrong, but maybe want to clarify that with policy as well, and Sam on how that works.
Yeah, we can definitely get an answer to what should be happening. And then that might also be a good thing to run by some community partners to make sure what we think is happening is what's actually happening.
Exactly. There's one that I hadn't read yet, but I think is really important for us all to just remember and continue to bring up for community members. The one thing that Marina had brought up is that for folks that have active full OHP coverage or active coverage that's anything other than COWM, and financial assistance on the marketplace, they may be responsible for paying, or they'll be responsible for paying full price for a marketplace plan and won't be eligible for any financial assistance. So, and if they do have full HP coverage and financial assistance, they may be responsible for paying some of that back. So just make sure to always talk to folks about it, make sure that they understand that if they have OHP, they would have to they wouldn't be eligible for financial assistance, or have to pay full price for Marketplace Plan. So just, it's good to have that conversation with folks so that they're aware.
Mm-hmm.
I think we got almost all of them. Guys, if there's any that I missed, I apologize. Feel free to either put them back in the chat box, or we'll try and cover them. You can always reach out to your ROC as well directly if we didn't catch something today, and we'll make sure to grab it. But I don't see any new ones coming in. So if folks have anything else that they'd really love for us to answer while you have us, feel free to put it in the chat box. I start in the questions box.
Absolutely. Yeah, and as a note, there's over 150 of you, so it is very possible that we missed something, and it is not that we are ignoring you. So please, if we missed anything, let us know. I think there's a few things that we might be following up with outside of this presentation.
Yeah.
And I do see a question about how to access the Q&A responses. Other than a few very specific things that are tied to an individual case or situation, we have said them all out loud.
Mm-hmm.
So there shouldn't be anything that's written down that won't also be on this recording for you to access later. So I think accessing this recording will be your best way to get the answers to those questions. And I'm realizing I have a slide as people maybe mull over their final questions, just reminding us all that this is an ongoing series. It is now called the Oregon Eligibility Ongoing Learning, Oregon Eligibility Webinar. You may hear us call them the ONE webinars. We'll see what sticks with the new name. But those happen on the fourth Wednesday of each month at 9 a.m. in English. And then there's always a follow-up one in Spanish as well. It is not on this slide, so I cannot tell you with certainty when it happens. But I know that this same content will be repeated in Spanish soon. And I am a little surprised I don't have that information. So that's on me, I'm sorry. But if you want to find more information about the English or Spanish availability of these webinars, any of the past materials, I will put up the materials for this one as soon as we're all ready to go. All of that is on GroupSite. There is a training specific section on GroupSite where we are putting all of those materials for easier perusal. And we're really excited to continue to offer you these webinars where we tackle things that are new, things that we've been hearing people are very concerned about or have questions about. And if there's any content at all that you all think is important for us to cover, please let us know. We put these together. I mean, I learn a lot through making these and working on them, but we do this so that you have what you need to really be successful at the OHP portions of your work. So if there's ever anything you want more support on, you want to learn more about, don't be shy. Feel free to let us know, let your ROC know. And we really enjoy having the opportunity to interact with you in this setting and all the other ones we do. But I really enjoy these webinars and how very engaged everyone is and all the great questions we get. So thank you so much.